Hello, everybody, and welcome to another session of Presenting Our Presence. We are honored this morning, we being Kyle Napier, my co-host, and myself, Florence Glanfield, to have our colleague, Suzy Depledge, with us. And first of all, Suzy, welcome to Presenting Our Presence. So wonderful to have you here today. I'll give Kyle an opportunity to introduce themselves, and then we'll turn it over to you to introduce yourself in whatever way you feel comfortable. Thank you.
So excited to join in the discussion today, and thank you, Florence. So, Suzy, very much looking forward to continuing the conversation, even with a previous guest that we had on in discussion of dentistry and as that related to Indigenous communities and even your connection. And I'm excited to hear about the many hats and roles that you have at the University of Alberta. So just excited for our conversation today.
Well, thank you, everybody. It's such a pleasure to be here. I'm really honored to have this opportunity to speak with you both. Florence has been a mentor of mine, and I've really had a lovely opportunity to get to know her through the Indigenous Advisory Council. So that's been wonderful. So I am Métis, so I'm a Métis Nation of Alberta citizen. My children are also Métis Nation of Alberta citizens. I'm from the Inkster family, which is from the Red River settlement, and my uncle, my dad's brother, did the genealogy, so that's how we know our family history. But I didn't have the opportunity to grow up Métis, other than my grandmother knew that she was Métis, but we didn't speak of it very often. So I'm learning myself about being Métis along the way and teaching my children what that means for them to be part of the community. So I have a couple notes because I am a little nervous, so I'll just rattle it off. So I was a grad from U of A. I did my BSc here. I went to UBC for my dentistry. So I practiced in BC for 16 years and came back and did my MBA. I married my husband, who's a biology professor here at U of A. So we're all at the U of A, and we have a little girl who's 5 years old. Her name is Charlotte. I speak of her a lot. And my two boys are here as well. So they're in business at U of A, and they're 19 and 21. So we're all sort of focused around the University of Alberta right now, which has been wonderful. I work at the School of Dentistry. So I have a few hats over here, which I'm sort of taking more and more on, which I love, mostly working with the students. So I'm the new associate chair for learning and advocacy for well-being. I'm an ADA, an Alberta Dental Association board member. I'm a comprehensive care director at the school, so I work closely with the 3rd and 4th year students, and that's how I got to be involved with the Access for All dentistry. And I'm the elective course director, and so the Access for All program is now incorporated into the elective program. And I'm also a proud member of the Indigenous Advisory Council, which is led by Florence Glanfield.
So first of all, lots to unpack, but perhaps we can start with the Dentistry for All initiative. I mean, I always love the way you light up when you talk about that important work. And you talked something subtle in your introduction about it being a part of the core experience now. So perhaps you can tell us what the Dentistry for All initiative is. Thank you.
Yeah, absolutely. So there's a bit of history behind the Access for All Dentistry, which is a student-led initiative. And so we had been dreaming this up since before COVID. And the students actually themselves created the Access for All Dentistry. It was Walter and Reed, and they were the initial students from a long time ago that wanted to give access to care for rural and remote communities in Alberta and around Canada. So they were first able to connect with the Yukon. And so their first trip was actually to the Yukon. And I had just recently learned that I was Métis. So I had reached out to the Métis Nation of Alberta at the time to Regan Bartel to say, is there any projects that we can do together? I'd like to give back as a professional, and I'd like to welcome the Métis community at least into the clinic, and if not, find a way to go out to the rural Métis communities. So Regan and I first had invited the Métis citizens to to the School of Dentistry. So we had the pediatric patients come to see us to our pediatric program, which was wonderful timing because our busing program had stopped. And so we had the capacity to add new patients in, and it was really successful. We had a lot of patients coming from all over Alberta that were Métis Nation of Alberta citizens, and it was a safe place for them to come. We had provided them good care with the students. We had opened up the program then to the adults, and this was during the time of COVID, so we were able to provide care at the School of Dentistry, but we still wanted to go out into the rural Métis communities. So our plans were put on hold for a year or two, and then we sort of got back at it again. And that's when Paulette Dahleseide, who you met, she's a dental hygienist, and she's part of our U of A School of Dentistry community as well. And her dream had always been to have provided oral health care to the rural and remote communities in Alberta. And so she had approached Reagan before me to dream up this idea, and Reagan was on board, and then I kind of came on board, and it was the three of us, the three musketeers, that kept on dreaming, and we decided we were going to trailblaze ahead and get this program going. So we called it a pilot program, and we went out in the year of 2022 and 2023. So we went out to Lac La Bishe. That was our first project. And we had a small group of dental students and dental hygiene students, and we were just in a very small community hall, and we just sort of went at it. And we brought mobile units out there, and the students were wonderful. The community was amazing. We worked really closely with the Métis Nation of Alberta to find a community space that we could have community gatherings, and we could also have the oral healthcare space. And so part of it was to provide a safe space for our community members to come in with familiar faces and food and games and activities that both our students and the patients could enjoy. So sometimes we could have patients that would come in, they'd have a cup of coffee and they'd peek around the corner, and then they decide maybe they'd get their teeth cleaned today, and they'd come in and get their teeth cleaned, and we'd find a little filling, and the students would say, you know, we could do this for you, and they'd say, okay. So we got a lot of really good feedback. So that was our first experience with Lac La Bishe, and then we in 2023 in the winter term, we went out to Cold Lake, and same thing, wonderful experiences for the students, wonderful experiences for the patients. So yeah, it's a joy project. As you can see, my face does light up when I talk about it. I love the program. It's so wonderful for the students. They learn so much about themselves. They learn about caring for patients in their own community, meeting people where they're at, and having a wonderful time, quite frankly. So,
Suzy, as you describe this now, can you tell us about how many students travel with you from the school to participate in the activities?
Yeah, we have about 15 students that participate, and they are mostly fourth year students. We have about 8 fourth years, and the rest are some third years, and also some dental hygiene students as well. We have a new dental assisting program, so we're hoping to include them as part of our team. Part of the beauty of it is when they work out there, they do work as a team. So it's dental hygienists, it's dentistry, it's working together. They all exchange roles. They are assistants, they are administrators, and so and it's very much student led. They do have some free rein to take care of their own initiative.
That's so fascinating and really exciting, and I understand the students, some who are Indigenous but others who are not, are all involved in this process. So they're also getting the experience of what it might mean to work or meet the needs of people who live outside of the urban areas.
Absolutely. It's a brand new world for all our students when they go into small communities, and a lot of them go out to Access for All and they realize that they like small communities. They love the feel of the people, they like the feel of the town, and they end up exploring going out to practice in rural communities. So part of the beauty of this program, I think, at the university is that it is Indigenous led. So myself, I'm Métis, Paulette is Métis, and we are Indigenous faculty members leading presenting this program. And any Indigenous student that identifies or self-identifies that wants to come on the trip or be a part of the trip absolutely is first in line to have these experiences. So, and they can go back to their communities, or they can go back to other Métis communities and give back. And, you know, you hope you find that one little girl or that one little child that looks up and says, hey, I can be a dentist too, right? Like they were going out there and showing other little people that they can become dentists as well, or dental hygienists or dental assistants. So that's our hope as well, to make that a possibility in their minds.
Suzy, it's so curious, like you have such a diversity of perspectives on dentistry, whether it is as a practitioner, or whether, you know, in working with on this research program, working with and engaging young people and getting them interested, or as a chair, or as a director, or as an instructor, and as a professor. So just in this multifaceted perspective on dentistry, and how that applies in your own experiences, particularly, you know, as both you and Florence addressed, in communities outside of urban areas. I think that you have a novel perspective, and so you know, I'm interested in what you have ahead of you. Do you have upcoming research that you're going to publish? Like what is it that you have planned down the road that you might be that you're interested in bringing to the space of dentistry?
Yeah, it's been an interesting journey. You know, we sort of go at it one trip at a time, and we've been really successful, and it's growing, and we've been so grateful for the support of the M&A and support of the community as well. The students just go out there and they're so joyful. You know, all the hard work behind the scenes makes it worth it to see them out there treating patients and getting to know community members. So at this point in time, we have an oral health access fund grant application in that we just submitted. So we're hoping to get some more support financially, so we can continue these trips and expand these trips. And so my goal and my hope has always been that every student gets to experience this once in their dental career. And so they will have the opportunity to experience this once, like 1 week out of their whole career here with us at the school. So, and we have done one little research paper. We did do some studies on, you know, the families that came into the KEC clinic, which is our School of Dentistry clinic, what they experienced when they came here as patients. Would they come back? Did they have a good experience? And it was a resounding yes. So I'm happy to say they were very happy with coming here. The only comments were about travel distance. So we had a lot of patients that were coming from a very long way away. And so that's when we learned through our research that, you know, going out to the communities was a good idea to meet them where they're at in these spaces. And so we see patients that are coming, even when we're out in rural communities, they're coming from an hour's drive away to see us. A lot of people that have never seen a dentist before, a lot of people who haven't seen a dentist in 20 years. And so we're providing access to care for not only financial reasons, but for non-financial reasons. And that's really important as far as, you know, getting those people to take the first step into the dental clinic and into the dental chair. And then when we go into these small communities, we also have continuity of care with the local dentists. And so that only, you know, we get them in the door and we have those conversations, but hopefully this is the first steps towards oral health care for, you know, the patients in the long run. So yeah, we plan to expand the program. We do have opportunities to do more research. That would be in partnership with the Métis Nation of Alberta. We have a very close, trusting partnership. We have an MOU with them from 2020 that has always envisioned the students going out to rural communities, has always envisioned research based on the experiences they have and based on improving the experiences. So Paulette, by the way, is going to be very heavily involved in that. So I've got quite a bit on my plate, but she's coming into the School of Dentistry, and I'm hoping with her master's behind her and her ability to do research that she'll be taking the lead on some of those projects.
That's wonderful. And you're taking a solutions-oriented approach to a really complex issue. I mean, something that I know all three of us are aware of, but to a listener that's not from an Indigenous rural community might not be aware of, are the prohibitive barriers to access to dental hygienists, to dentists, and to adequate dental care. And so to go to community and provide that level of access, and especially an interest in training to young people to go out and to bring those skills back, it counters what what I've experienced in the North, which is sometimes there are predatory dentists, right, who come up and take advantage of the type of healthcare that is available in these communities, or community members having to travel hundreds of kilometers to get to a place where they can trust that the services are done to their needs. So yeah, I'm just curious. You must have so many thoughts around responding to the complexities of dental needs and dental care in these communities.
Yeah, I think that initially we were thinking about doing like a needs assessment based research. And quite frankly, Reagan Bartel, the health director at the time, she said, we don't want to be studied anymore. We don't want to be, we need services. We need teeth pulled, we need services. And so we did pivot our approach as far as going into community to provide services. And so it was service first and perhaps research after that, in partnership with the Métis Nation of Alberta. So, our focus is definitely on the students getting the experience to go into rural communities and provide those services, and for the patients to get those services that they need. And it really has been a beautiful thing. I think Paulette has said it that way. If you come in and watch it, it's just really phenomenal the way the students can interact and meet people where they're at if they've never been to the dentist for 20 years, and the way that the patients actually feel like they're giving back to the students, which is it's a beautiful thing to see, because they feel like they're coming together as a community, right? Like Métis people do, and they come together and they dance together, and we have dinners together and potlucks, and the students go on nature walks. And that was, if you ask the students what their favorite part about the whole event would be, the jigging lessons that they had and the nature walks. And that was just, you can't get that at school. You cannot provide those experiences in a clinical classroom setting. These are things that they'll take with them for the rest of their careers, right? So
I'm curious, like, nested in all of this, what was your catalyst? What was your passion? What brought you to the interest in the space to begin with?
Two things, I guess. The first one is obviously the students, right? I mean, I love them and I love seeing their passion out in community, and they provide great services. And the other one's a little more personal for me as well, as far as, this is a journey for me to discover who I am, to reconnect to Métis communities in Alberta, and to find my family. And so every time I go into a small community, I'm like, well, maybe someone knows my grandma, maybe someone knows my family. And that actually happened when we were in Slave Lake the last time, because my grandfather had taught there. He was a principal of a school. And so when we were at one of the community gatherings, she recognized my name, this lady who is Métis, and she came up to me and she said, "Do you know Suzy Depledge?" And I'm like, "He's my grandfather." And so she actually put me in her truck, and she drove me by my grandpa's house where they used to live, where my dad grew up, which I'd never seen before in my life. And then she drove me by the school where my grandpa was principal, and they were the neighbors. They were my grandparents' neighbors. So those personal connections, I can't even, I search for when I go on these trips, and I actually found somebody who knew my family, and that's just priceless, right? So to find those Métis connections, the lady was Métis, and to find connections to my family as well was just priceless. So when I go out to the trips, I also bring my 5-year-old daughter. It's a little tricky because she is 5, and so I'm trying to get her, busy and stay out of the way. But I try to make a point to bring her, because I want her to have those opportunities to come out to Métis communities and know she is Métis, and to find some family, and to learn how to jig, and to just be in a community space where she feels accepted and to feel part of that community. So personally, this has been, I'm so grateful to have this opportunity. You know, it's a wonderful thing for the students to have, but as personally, I've grown so much in the past couple of years to get out to these communities and feel at home, really, with people who my family knew.
I love that you take this group of humans who are all becoming it their roles as dental hygienists, dental assistants, or dentists, right? And you take them to community. Where do they stay when you're in community? How do you organize that part? How do you get the jigging lessons? Like, who helps you? Like, how do these students find a space? And how do you get, like, as you're telling me this, I remember I wanted to ask you that when I first learned about this program, and I forgot to. And now I'm thinking again, how do you do this? What is the practicality of finding places for people to stay?
Yeah, it's you know, we really didn't think this through completely. We just knew where we were going. Quite frankly, we didn't really have a master plan. We just decided to trailblaze ahead, like you called it, Florence. And we meet up with local community. So the Métis Nation of Alberta has been amazing. They have coordinators on their end that help us book the patients and help us find community settings. We have Patterson Dental, who goes out to each location and make sure that we have all the power and water and suction and everything that we need in a suitable location. So we have to find the community space first. And then we stay in a variety of places. Our favorite places, by the way, have been a bed and breakfast out in Lac La Bishe. I think it's called Harborfront bread and breakfast, run by a Métis lady, and she was so lovely. And then our other favorite place was called Bannock and Bed, and that was out in Fost, little tiny hamlet near Slave Lake, and it was so beautiful. Our plan was actually to stay in the teepees because it was April and we had booked the teepees and we had booked the whole place, and we thought, oh, this is going to be wonderful. The students had seen the northern lights out there. It was just an amazing experience. The host welcomed us into her home. She made meals for us. So we stay together. Those are our favorite places. We have stayed in hotels as well, in bigger venues, but our favorite places, and I think we'll try to do it in the future years, is to stay together because the students just love to share. I mean, they share meals together there. They study together. It's pretty wonderful. So in our last place, so it was a little cold. We were early in April. They had opened it up early for us, you know, crossing our fingers we'd have great weather, and we had actually a little bit of snow, I think, before we got there. So some of the students toughed it out and they stayed in the teepees for a few nights, but basically they all piled into the house and they had a wonderful time. We offered to get them hotel rooms, but no, we love it here. So and the lady's house was amazing. She had a lot of just Indigenous artwork, and she had a lot of like family treasures that she walked us through and told us stories about. And so that's more of an experience than you can get in a hotel for sure. So, but every location is different. We go region by region. So we've done, I think, 1 through 5. Our next one will be Region 6, which is now obviously, as you know, Florence district. So our next trips will be Grand Prairie, Okotoks, and Hinton. We've already planned those out for the year. So we have some time to look at little places and see what will be fun and cool and interesting for the students to experience. So yeah, so we do work closely with the M&A. We work with the local leadership as well. They can guide us to some friends and family or some other people who have bed and breakfast or some interesting places that we can experience.
Well, thank you for that, because I really appreciate it. And so the partnership, even when you talked about the dental, supplies, that didn't even cross my mind before. Like water, what do you need? And now that I think about when I go to see my dental hygienist, what do they have access to when I'm sitting in that chair? And now all of that needs to come in a portable way, I guess. Is that correct?
Yeah, we've learned a lot along the way, I'll tell you for sure. We have portable x-rays. They've been amazing. We have portable chairs, and so we sort of gather equipment per year, depending on our funding and our donations. And Patterson Dental have been amazing. They've been our best friends. They come out with us, they set us up. They've supplied the mobile units. So we have between 6 to 8 mobile units, and they do scout out the place for water drainage, voltage, that type of thing. So, and then we also want to have a nice community space. So we spend quite a bit of time making sure we have the right venue for our Métis citizens and our patients that come in to see us. So, yeah.
Wow. Well, what a beautiful collaboration between the Métis Nation, industry in a way, in the dental professional life, right? And the communities that come together and the faculty. Wow, that's really beautiful. Thank you. Thank you. So I think it was when Suzy first started at the University of Alberta that she reached out to me, if I remember correctly. And we just met and we just started to visit with one another. And as Suzy talked, it's about, there's an opportunity. Suzy's on her journey of learning what it means to be Métis. And one of the pieces right from the very beginning was that she said, I'm wanting to learn and I'm wanting to connect with community. And you told me the story of your grandmother, actually, Suzy, right? And that coming from Alberta. So you knew there was some connection here to Alberta. So that's how we first met. And I just remember how profound that was, because there are lots of people who might come to learn that they are Métis, and families, I know for a long time, some families never talked about the relationship with the communities that they were part of as growing up for a variety of reasons. And when I think about my own family and how my grandmother, never called herself Métis. My grandmother never called herself Native. Like there was times there were these decisions made for the better of the next generation, in their opinion. But we are now living, and I always knew I was Métis, but it was even a conversation I couldn't have with my grandmother. And so it's very interesting because Suzy's story resonated with me in a bit, that this is coming to understand who you are as well. So in whatever way, Suzy and I continue to have these conversations, because it's understanding then when we identify, and now as a faculty member, when we identify as Métis, when we take on professional roles and we identify as Indigenous, then there are also expectations of us. And so Suzy and I talk about to what degree, when we contribute to our professional careers, our professional organizations, how do we hold up what we understand as Indigenous people within those spaces? So Suzy and I also talk about that, just in who we are as human beings who have responsibilities to these multiple communities, our own communities, our families, and professional organizations and responsibilities.
No, it just brings me back to my grandmother, who I did spend the past 5 years with, from the age of 90 to 95. And Nella had always asked me, when I talked about my grandmother, she said, you should record her stories. You should really record her stories. And I'd ask my grandma about being Métis, and she would just turn her head and she wouldn't tell me anything. So, or she'd pretend she couldn't hear me, and I know she could hear me. So unfortunately, I didn't get a lot of stories from my grandma. I remember things with my grandma as far as music. She had, Métis fiddling in the background, and she, there's very small bits of Métis that she would have around the house, like artwork, or she would give us moccasins, like these beautiful beaded moccasins for Christmas. And it was there, but it wasn't front and center in our family by any means. So so I've kind of, you know, my grandma did pass at the age of 95, and I didn't get any stories from her, but I've kind of realized I can do this for my own family. I can, you know, I can go out to community, I can provide dental service and provide care for people, but I also get a lot out of it too. I, you know, sitting in those rooms and hearing the stories from other families, and including my daughter in there, and she has little ribbon skirts, you know, so we've had matching ribbon skirts to some of these events, which is pretty cute. But you know, there's opportunities for me to become a part of the Métis community and give back. And there's opportunities for my children to really learn about the Métis culture and where are they from? Who are they? What is the part of history that they weren't able to understand up until now? But they do have this opportunity, and I'm really grateful for it. I'm really grateful for the gift of going out to the communities.
And it seems like your students are as well. Not only are, you know, people who are involved in either of the research projects that you're involved in, bringing care to communities, but in doing so, not only do you have people involved in the team, but also you know, students of yours, and so it really seems like they have exposure to the realities of what the needs are in community, and how far people are willing to travel to get access to that adequate service. So yeah, I'm curious on your thoughts on that.
Yeah, I feel like the students, it's such an eye-opener for them. And again, these are experiences that you just can't get anywhere else other than going out to community mobile clinics. And you know, this is a student-led organization, and they do put in a ton of work day in, day out, organizing supplies, organizing materials, putting schedules together, having meetings, choosing locations, accommodation. So I let the students lead as much as they possibly can, and I'm their backup. So I'm their faculty backup to make sure, you know, everything goes as according to plan. So all the students want to go on this trip. We have, you know, 24 spots for the fourth years. We have 52 students. So that's why we're hoping with some more funding that we'll be able to open it up to more students to get these experiences. And not only have the students have the experiences, but also we can then serve more patients in the community. So, but as far as life-changing experiences, I would say this is top of the list in their fourth year. So they really just enjoy their experience. They enjoy the dental work. They enjoy getting the clinical dental work done, but they also enjoy the visiting, right? The chairside visiting, learning about their patients, learning about the community, and in engaging in the community in the evenings as far as having those social events as well. So I think they get a real feel for what it would be like for them to join a small community and become a rural dentist. So yeah, I've had quite a few students go out to Access for All and then graduate, and they end up in the small communities, and they do love it. So they end up choosing those roles.
There's a reason that many of these communities are experiencing trauma related to access to dental care. And so I'm just really appreciative of the services that you deliver and your model of delivery with both students, clients, and community.
Yeah, and I think that's we're trying to promote that for our students that graduate, as far as what can they do to become a good provider once they're out in their communities. Are they providing care in a culturally safe space? Are they listening to their patients as far as what their background was and if they had any existing traumas? So we're trying to provide, teach our students to be kind and compassionate caregivers, and also to sit down and listen and meet people where they're at, right? Really, that's truly the thing that we want them to do, is to sit and meet people where they're at, as far as what is their history and why did it take a long time for them to see the dentist, and how can we help people? So I think some improvements that we can make in Access for All are definitely some of our preventative care, to include the dental hygienists a little bit more, and to even have sessions during the community events as far as doing oral health care advocacy, and doing some teaching to the younger kids with brushing and with flossing and things like that. So, but the students, they really just, I think, again, they learn so much from being out there, and they learn to be kind and compassionate, and they learn as they're working. These are things that you can do slides in classrooms on, and it doesn't really have the same impact as far as getting them out to community and learning it as they're treating their patients.
I want to thank you for your contributions and for all the ways that you are connecting the University of Alberta students with communities and Métis communities across the province of Alberta. And thank you for spending this time with us and letting us know a bit about your passions and how you live those out within the context that you contribute to at the University of Alberta.
With that, it's always refreshing to talk to professionals who are making these transformative changes in their field, and what even decolonizing praxis in communities can emerge to be, right? When you're responding to these types of needs, and working with community, like you said, to meet people where they are. And so yeah, just that type of care is really needed in communities like these, to speak from a personal perspective. So yeah, with that, I'm really grateful for this conversation, and looking forward to what's next for you.
Great. Well, thank you, Kyle, and thank you, Florence, for your time. I really appreciate being invited to this podcast. It's been an honor to be here today. I'm a very proud member of the University of Alberta, very proud member of the Métis Nation of Alberta. And, we're just going to continue to trailblaze ahead with the students and get them out to communities and have these wonderful experiences, which are, quite frankly, a personal blessing for me as well, and a gift. So I'm so grateful for these experiences.